Hello, my name is Quentin Broussard. I'm an assistant professor of clinical sciences at Keck Graduate Institute, School of Pharmacy and Health Sciences, and today we will be discussing root cause analysis. Our objectives for today will be to define and introduce root cause analysis, or RCA, to discuss the process and steps of RCA, to discuss how root cause analysis, or RCA, can help with tracking medication errors, and to also provide examples from pharmacy practice. So basically, how does RCA work and how is it applicable to pharmacy practice? Those will be the main things that we discuss today. In regards to root cause analysis, all organizations experience unintended variation in consequences, and such problems exist with a broad range of scope, persistence, and severity across all different industry areas. Some problems can be minor, but others can be often major, which can affect customers as well as income or money. And others can be actually a matter of life and death. So you may actually have errors out there where you might have them happen incidentally. And sometimes we can't always foolproof a process beforehand. However, even if we do try to foolproof that process beforehand, there still may be errors that can occur. So preventing problems is preferable to deal with the consequences. However, whenever you have recurrent problems that stand out like sore thumbs, these are probably the things that you're going to need the most prevention efforts in regards to, and that's where RCA, or a root cause analysis, can be important. So root cause analysis, as you can tell, can happen essentially after something happens. So the root cause. So behind every problem lies some kind of cause or causes. Every problem, may have multiple causes. Another problem may only have one cause. When you actually are trying to solve a problem or trying to figure out basically how a problem was occurring, what it is important to do is to identify the cause or causes of that problem and to find ways to eliminate these causes and to prevent them from occurring. What are the causes, though? Depending on the problem, approach is typically relatively simple, potentially. But it's very easy to underestimate the effort it takes to find causes of a problem. And once you've established the true causes, eliminating them is often a much easier task. And in some cases, it still may be a difficult task. So, in an example of a medication error, if you go about looking at what the cause of a certain medication error is, it may be easy to list off that error, and may be potentially easy to minimize that error or eliminate it, but sometimes it's not always eliminatable. We might need to actually implement something either informatics-wise or from a non-technology perspective to actually prevent something from happening. As a result, it's always important to identify a problem's cause. Because if you don't identify what the problem's cause is, it's going to continue to happen. For an example, say if someone gains a significant amount of weight over time, and you ask the question, why? Like, what is the cause of that? And then the person tells you, well, I've been eating lots of food lately. And then they ask you why. Or then you ask them why, and they said, well, I've been depressed lately because of my recent, divorce. And then you ask them, why have you been, upset about your recent divorce? Then that can be a further cause or further reason for you to continue investigating. So until that underlying problem of that anxiety, depression related to the divorce is essentially rectified, the patient or the situation may not be necessarily fixed. To make things even more complicated, as I just mentioned in that example, a problem can often be a result of multiple causes at different levels. So you might have first level causes or higher level causes that actually cause basically the event to happen. And this means that some causes affect other causes, and that will then create a more tangible problem at the end that is more seeable. So let's use an example that a lot of people are probably familiar with, the ship, the Titanic. So the problem here was that 1,500 people died in the sinking of the Titanic. Now, the question here is why? Whenever we try to establish a root cause or perform a root cause analysis, we're always wanting to ask the question why. So if you go back and think about, the Titanic and what you know about the Titanic from history, there are probably a lot of different reasons that you probably are aware of or were not aware of in regards to the deaths related to the Titanic. One of the big things with the Titanic sinking was that there were not enough lifeboats. Obviously, people died in the Titanic sinking because the boat sank. The water was essentially very cold where the boat had sank around because it had just hit an iceberg recently and then took on water. In addition, even if that, boat, still sank, the rescue boats that were recruited to get to the Titanic were too late in trying to rescue those people. So now if we go a little further back, why did we not have enough lifeboats? Why did the boat sink? And why were the rescue boats too late? Some of these things can actually trickle down a little bit further. So, not enough lifeboats. Why were there not enough lifeboats? Potentially in the early 1900s, whenever the Titanic sank, they actually didn't put a lot of lifeboats on the actual ship itself because they potentially wanted to make the boat look good. The Titanic was one of those first big ships out there that was almost like a luxury cruise liner, at least from my knowledge, and they wanted to make the boat look good. And additionally, there were no regulations and there was no legislation, necessarily necessitating how many lifeboats you had to actually have for the Titanic. Obviously, you might have had lifeboats on the Titanic, but they weren't enough to meet the capacity of that ship. In regards to the boat sinking, well, there was a tear in the bottom, and not all of the bulkheads, which is a part of the ship, were closed, and that is what caused the boat to sink. What caused the rescue boats to be too late? Maybe the SOS rockets that they fired were misinterpreted as fireworks. Maybe they just thought, they were potentially just having a good time with it. You don't know. Now, why were all of these things in place? Well, we keep going further back. And if you actually look in regards to tear in the bottom of the boat, reasons why there was a tear in the bottom of the boat was that it hit an iceberg. Another thing here is that the hull was not strong enough, or basically the exterior of the boat was not strong enough to take a collision with the iceberg, and that's why there was a tear in the bottom. So you see all these things actually feed into the event 1,500 people died. Then you have what are called first level causes, which are basically this first column of causes here. Not enough lifeboats, boat sank, rescue boats too late. Additionally, you have other things here that are known as higher causes. Those are things outside of the first level. So that basically includes wanted the boat to look good, no legislation, a tear in the bottom, bulkheads not closed, SOS rockets misinterpreted as fireworks, hit iceberg and not strong enough hull, not a hull that was strong enough, can also be interpreted as higher level causes of why those 1,500 people died. Remember, whenever we're identifying causes for a certain event. In this case, the event is the red 1,500 people died. In this case, you can make different arguments about what the root cause is. Obviously, one of the big things that resulted in the people dying was most likely that there was a tear in the bottom of the boat happening from the iceberg and potentially happening from a weak ship. So you could potentially contribute both of these things here, hit iceberg and not strong enough hold, because they're the furthest back. They may be the potential root causes. Ideally, we want to identify one root cause. However, there may be potential multiple root causes out there where we actually have to investigate a more contributing cause. You might say that hitting the iceberg was probably 70% of the reason why the Titanic sank. But you could make an argument and say, well, there was a part of it where the boat wasn't strong enough, and if it would have, hit something else, it probably would have broke as well, just like it did. And you might attribute maybe 30% to it being not strong enough of a hull. The root cause is usually the one that contributes the most. However, it's kind of hard to say which one may have contributed the most. If you had a stronger ship, would hitting that iceberg have been necessarily an issue? It's hard to say. And as a someone who doesn't manufacture or make boats routinely, I can't really answer that question. But all you need to know here, you don't necessarily need to know this example, but you need to be aware of how to identify an event, which usually the event most of the time will happen last, in addition to how to identify first level and then higher level causes as well as potential root causes. So causes. So causes can be classified as one of the following. So you have what are called symptoms. And if you actually go back to that Titanic slide, symptoms are not regarded as the actual cause, but rather as signs of an existing problem. So it may be something later on that happens, or it may be the actual event itself, like the 1,500 people dying. First level causes are causes that directly lead to the problem. So that first column after, to the right of 1,500 people died, those are first level causes. Higher level causes are the ones that lead to the first level causes, ideally. So you can basically stratify that to be the third column or even the fourth column, because the third and the fourth columns eventually lead to the first level causes. And although they do not directly cause the problem, higher level causes form links in the chain of cause and effect that ultimately create the problem. So those higher level causes are a real big problem. Because one of them may be the actual root cause or the most important thing contributing to your actual event happening or your symptom happening. Some problems have compound causes where factors combine. And the highest level cause is called, like we said, the root cause. It's the evil at the bottom that sets in motion cause and effect chains. So basically, the root cause caused this to happen, which causes this to happen, which causes other things to happen, which causes our event. So here, you actually see another illustration of it, where you have the root cause causing a higher level cause. Then that causes a first level cause, and then it can cause a problem or a symptom. After this first level cause here, you're going to get the problem. And then potentially that problem either can be the problem or it can be a symptom. And then that problem can lead to a potential symptom. In the case of the Titanic, one thing that you can say in regards to a symptom, if 1,500 people died, you might say people might have had excessive mourning or more mourning after the event happened, particularly if they had family members or friends on the boat. That might have led to an increased amount of utilization in funerals and funeral cost. Those things would be symptoms of the visible problem. The visible problem here would be 1,500 people dying. Root cause elimination. So how do you ensure that your problem, once it has caused a serious event, does not recur again over the next day, week, month, year? Do you think it's simply a one-off thing that will never happen again? But obviously, if it can happen once, it can happen again, correct? As long as there's always that root cause there. What's to say that the root cause couldn't happen in another situation with another patient, for example, in a pharmacy setting? You might have some approaches that provide temporary relief, but they're never going to produce a long-lasting solution. And remember, if you only attack symptoms, those things at the beginning or the end part of your root cause map, then you will never actually produce a long-lasting solution, and your situation become worse. The problem will still be there, and there's going to be no longer an easily recognized symptom that can be monitored. So one of the big things right now in the news is coronavirus, COVID-19. So essentially, if you just try to, minimize the exposure of the sick positive COVID-19 patients, or even the non-sick COVID-19 patients, because there's also non-sick COVID-19 patients out there. If you just try to basically stratify those patients off, doesn't necessarily mean that you're fixing what the root cause is. And in that regard, you might continue asking the question, why, does this virus keep spreading? Well, we have other measures that we're taking in place with this COVID-19 situation, such as social distancing, washing your hands constantly to minimize any risk of the virus being on your hands or in your general area. We're taking additional steps here because while being in proximity to people is a major cause of COVID-19, it's not the only one. So you have to keep that in the back of your mind. And remember that if you eliminate a first level or a higher level problem, it can temporarily relieve things, but you still got to get rid of that root cause to basically eliminate it so that the problem doesn't keep manifesting itself in another way. It's always important that we fix the root cause. Always go all the way back. So currently, there's no commonly accepted definition of root cause analysis. In general, it describes a process for identifying the basic or causal factors that underlie variation in performance. So the meaning of the term root cause analysis ranges from descriptions of simple quality tools to applications of a full problem-solving cycle of improvement. Ideally, root cause analysis is understood as a wide range of approaches, tools, and techniques used to uncover causes or problems and eliminate them. So we want to ideally identify whatever the underlying issue is. That is the big thing in root cause, or issues, because sometimes there may be multiple things that we have to account for. Conducting a root cause analysis entails a sequence of different steps. The step names and subtypes vary between methods and to describe them based on their most key action. So in striving for simplicity, we focus on a process as a 6-step approach. And this is a very important 6-step approach to know for your exam. Hint, hint, star, star. Know the order of this process. So the RCA follows about 6 different steps: defining the event and succinctly describing the event or deviation that triggered the need for the root cause analysis. So basically, in the example of the Titanic, the event was 1,500 people died. Find causes, coming up with a broad range of potential causes of the problem as possible. So that is basically where we do our first level causes and our higher level causes to eventually stratify everything out about what caused this event to happen. Why did this thing happen? And you're going to ask the question why probably about 1,000,000 times before you actually get down to what your actual root cause is. Hopefully it won't be 1,000,000 times, but you're probably going to ask the question why a lot in regards to actually identifying what the root cause is. Once you've asked the question why many times, and you kind of start to figure out where a deficiency in the system is, you'll eventually find what the root cause is. And usually the root cause is one of those higher level causes that you have identified. The next thing that you'll do is you'll find solutions to solve the problem and prevent the problem again from recurring. So what are you going to do to basically solve that problem and prevent it from occurring again? What is your plan going to be? And that's where we kind of talk about medication error reduction plans, which we'll talk about in a few weeks. We also take action, implement solutions to ensure that things stay that way. So once you find the solution, how do you implement that solution? How are you going to go about doing it? You may need actual buy-in from multiple stakeholders, such as pharmacists, physicians, nurses, pharmacy technicians, other healthcare practitioners to actually implement your solution. And then once you have implemented a solution, you want to measure and assess to determine whether the solutions work and solve the problem. So this basically kind of just reiterates what we just talked about on the last slide. You want to define the event that occurred, find the causes of that event, find the root cause. Once you find the root cause, you want to develop a solution, take an action. So basically, how do you go about implementing that solution and implement that solution? And then you want to measure and reassess, did my solution actually work in regards to my problem? Do I need to, how can I actually tell whether or not my solution is working? I need to maybe run a report to see, how much this is actually occurring. Have I gotten any complaints? Basically, have we had any other patient safety issues that have been similar to that one problem? If not, you're probably doing a pretty good job. But we also use things like data analytics to do this step 6. So defining the event and basically breaking this down a little bit further. So in regards to the steps, and again, the steps are hint, hint, star, star. So you need to know ideally the order of how these steps go. Defining the event. So the purpose is define the scope of your problem, provide a starting point. Organize your root cause analysis team. Your root cause analysis team may not just be pharmacists, it may be doctors, it may be nurses, it may be other healthcare practitioners. And then you want to create a realistic project plan. You want to identify the problem, have your RCA team ready, and you want to make your plan. This is an analytical step. Typically about 5 to 10% of your duration of the RCA lies in this step, though don't necessarily worry about these percentages. These percentages are not hard and fast, and it always varies depending on your particular issue. Some success factors include being specific and objective. There's no necessarily speculation at this point as what to cause the event. You have relevant team composition, so you have a well-balanced team. And you want to schedule balances of ambition and time. So obviously you're not going to go too far in trying to basically make this your whole workload. This may be one of several projects that you have on your plate at the time. So you want to make sure that you're allocating appropriate time to your project. Not too much, but also not too little where you're not going to do a great job. Some tools that you can use interviews and surveys of people. A lot of times we actually interview the people who were involved in the medication error, the medication event happening. Finding causes. So how do we go about, understanding the problem better? We want to create a broad overview of possible causes, so those first and higher level causes. And we want to ensure that all involved are heard. We want to list all the possible causes, not just the first level, but we also want to go to the higher level as well, as high as we can go where we think it's feasible. At some point, you might have to stop, and you might, once you get to a point of asking why, there might not be anything else really to place down, because you can only, place down things going back so far in terms of your root cause map. This is a creative step, typically around 10 to 15% of your duration, but again, this varies. Again, you don't need to know the percentages. So you obviously will have access to background data and evidence about the problem. You'll need to be able to think creatively, as we saw there with the Titanic situation, and no sorting or screening or suggestions for possible causes. So you shouldn't necessarily just focus on one cause. You need to basically do the whole map and basically look at everything, not just one thing. You can use flowcharts for this. You can use high-level mapping. You can use brainstorming. And then you can also use a fishbone diagram as well. Finding the root cause. So uncovering the real root event or the root cause that caused the problem or the event. This step is analytical, takes about 20 to 30% of your time typically. It's important to keep an analytical and calm mind when doing this. It's important not to declare the root cause too soon, because what's going to happen is that you might actually have overlooked something. So some tools that you might want to look at in regards to this are a cause and event tree. You might want to keep asking why. We always refer to why as the 5 whys. So if you're asking why at least 5 times, you're probably going to get to a good point where you can identify a first level or higher level cause. You might have other different charts and schematics here as well. These are just some examples like Pareto analysis, scatter chart, histogram, or problem concentration diagram. We're not going to go into necessarily what each of these things are. Obviously, with Pareto, I believe Pareto is a pie chart if I remember correctly. But just be aware that there are multiple ways that you can actually use tools to identify a root cause. Then you want to find the solution or identify a solution. So you want to identify something that is going to eliminate your root cause or minimize your root cause. Again, this is something that will take up a significant amount of time, 15 to 25% of your duration. And you want to basically involve those with ideas about possible solutions. So how am I going to go about eliminating this root cause? How am I going to involve those who will be affected by the solution? And how are we going to have creative ownership of the required changes? So again, that includes things like flowcharts, interviewing people and talking to people, talking things out. How are we going to go about this and try to minimize whatever the root cause is? We might survey, we might brainstorm, benchmark, and then obviously, we need to then, in addition to asking why, we might ask why not. So, why is something done in a certain way, and why are we not doing it this way? What way would be the best for us to actually implement this so that we minimize the risk of this event again happening in the future? Then we're going to take action. We're going to implement those solutions. This can take 5 to up to 50% of your time. Sometimes it's only about the planning, but sometimes it's a lot about the actual implementation of that solution. So you want to involve those who will have their who will have change to their work processes, and you have to be patient and persistent with them. You might want to use different types of analyses to basically try to implement your solutions, like an impact effort matrix or a force field analysis. Again, we're not going to get into these either in regards to what these actually are. Just be aware that these can be used. And then we're going to measure and assess. So did we actually, or were we effective in implementing the solutions? Did we, or were we good in regards to our overall efforts? Did we do a sufficient job in basically minimizing the effort? And minimizing whatever the root cause was and minimizing what that event was that happened. And then obviously close the project if basically there is no need to further proceed, assuming that there has been no issues with your implemented solution. So obviously we want to be critical of our solutions. We might even, make small little tweaks here and there if we see that something was not correct. So don't be too eager in declaring success in closing of a project. You might have to wait months before you actually close a project, sometimes even years. Sometimes things might occur where something was that big where you actually need to keep reevaluating and keep reporting about it to make sure that your patients are kept safe. So you might potentially do something like a pilot study to make sure that your solutions have been implemented appropriately. So again, our summary of our RCA steps. So the purpose column was the column that provided the keywords to describe why the step was included in the RCA process. The output was the main products that should result from the execution of the step, again limited to those key elements. And then characteristic. This is an attempt to indicate whether each step is typically analytical or creative in nature. And it's perhaps a little ambitious to label one as analytical or creative. Some steps exhibit both characteristics. However, this helps to identify the main mode of thinking that you need to use whenever you're going through each step. So do you need to be more creative with a certain step? Do you need to be more analytical? That's basically what we're getting at here. Percent duration, it's probably the, again, most imprecise. Duration obviously varies between each of these different steps. So again, you don't need to know the percent duration for these things. Success factors. This column lists key factors that should be observed to complete a step. And then the tools. Again, the tools are not necessarily something you need to use. Just be aware that there are tools out there. What I really just want you to be aware of in terms of the RCA steps is basically how do we go through implementing each one? Which one happens first? Which one happens second, third, fourth, fifth, and sixth? Hint, hint, star, star. So although RCA is presented as a linear and sequential process, in reality, there's often cases where you have overlapping steps and loops where it may be necessary to go back to earlier steps and do more work before proceeding. So, like I said earlier, whenever you develop a solution to your problem, you may do some preliminary analysis, like a step 6, to reassess what actually is going on with your actual implementation of your solution. And you might find that there might be a problem in the implementation of your solution. You might have to go back to step 1 and basically try to find additional causes of what was causing the problem. Because say if you have your problem recur again, is your solution really doing a good job? Is your root cause correctly identified? In a lot of cases, your root cause is, but there might be something you might be overlooking in terms of workflow. And you might need to go through and maybe do step 4 again, for example, where you actually start interviewing people to kind of figure out how you're going to go about basically forming your solution to the problem. So again, this is non-linear process, and you might have to go back to earlier steps. Hint, hint, star, star, and this is bolded. RCA in healthcare. So RCA, again, as you see, is a structure method used to analyze potentially serious events, not just related to sinks shipping like the Titanic, but also in regards to healthcare and medications. Originally, RCA was developed to analyze industrial accidents. However, it's now deployed as an error analysis in healthcare. A central tenet of RCA is to identify underlying problems that increase the likelihood of errors while avoiding the trap of focusing on mistakes by individuals. We don't want to necessarily focus on the individual. We want to focus on the process. Because if we focus more on the process, then basically once we identify the problem in the process, then we fix the problem in the process. You have to have the belief that a lot of individuals are going to be good faith and trying their hardest to minimize error. However, we know that that is sometimes, not the case. However, in most cases, the individual is trying to actually implement good faith practice in whatever kind of practice that they're doing. And as a result, that's where root cause analysis comes in. It really kind of helps us look at the process of what is going on versus trying to take it out on the individual. And a lot of times we shouldn't necessarily take things out on an individual. We should probably counsel them about it, but it doesn't necessarily necessitate that it will always result in discipline, such as penalties in regards to work compensation or even termination, basically firing. RCA uses systems approach to identify both active errors occurring at the point of interface between humans and a system, like information technology, and latent errors, hidden problems within the healthcare system that contribute to adverse events. It's one of the most widely used retrospective methods for detecting safety hazards. And again, retrospective. Usually an event will have happened already. RCA should generally follow a pre-specified protocol that begins with data collection and reconstruction of the event in question through record review and participant interviews. So whenever you do your RCA project with me, what you're going to be given is a simple case. And you are going to have to essentially conduct an interview with me as basically a participant, and I might be playing a role of a patient, physician, or some other healthcare practitioner, depending on who you're asking, for you to get more information about the situation. You might only have what the event was. Oh, this patient died. Then you're going to have to go through the process of going through the different whys of why did this patient die? Oh, they were taking an anticoagulant medication and they bled. Or, in that case, the first level cause would be they bled out. The higher level cause could be they were taking an anticoagulant medication. Well, why were they taking an anticoagulant medication? Oh, they had a DVT. So if you keep going back in the root cause analysis, or the root cause chart example that I showed you with the Titanic, essentially you find basically what that root cause is. A multidisciplinary team should then analyze the sequence of events leading to the error with goals of identifying how the error occurred through identification of active errors and why the error occurred through the systematic identification and analysis of latent errors. And the goal is to obviously prevent future harm by eliminating the latent errors, which are very often the ones that underlie the adverse events. A lot of times we don't typically always find something through an active error. It may be through passive methods that an error actually occurs, and you always want to keep that in the back of your mind. In regards to factors that may lead to latent errors, this table is very important. So this is a hint, star for this table right here. In regards to different factors, we have many different factors out there that influence or may lead to latent errors. One of them is institutional regulatory. So for example, if you had a patient who was taking an anticoagulant and received an IM pneumococcal vaccination, and that resulted in a hematoma and a prolonged hospitalization, that might obviously be a problem, right? However, in this case, the hospital was under regulatory pressure to improve its pneumococcal vaccination rates. So you see here, because they were under regulatory pressure, they had to actually give pneumococcal vaccinations probably in an increased amount, and they ended up doing so mistakenly on this person that was on anticoagulants. Organizational management. A nurse detected a medication error, but the physician discouraged her from reporting it. So this is kind of more along the lines of a chain of command thing. The nurse, wanted to report the error, but the physician, discouraged her from doing that. So basically, someone who oversees her work, or that nurse's work, and it's not necessarily a he or a she, may, influence what we do, and that's organizational or management related type factor. Work environment. Lacking the appropriate equipment to perform a hysteroscopy. Operating room staff improvised using equipment from other sets. During the procedure, the patient suffered an air embolism. So if you didn't use the right equipment, or if you didn't have the right things in your environment to basically do this, that would be a potential work environment error. Another thing would be potentially in terms of work environment right now with the lack of PPE or personal protective equipment with COVID-19 or coronavirus. If they don't have enough PPE out there to take care of patients, healthcare providers may actually contract the virus itself, and that might lead in response to that into its own type of error, not necessarily a medication error, but an error in itself. Team environment. A surgeon completed an operation despite being informed by the nurse and the anesthesiologist that the suction catheter tip was still missing. The tip was subsequently found inside the patient, requiring reoperation. So obviously the surgeon here didn't listen to his colleagues in regards to a missing suction catheter tip. And as a result, they had to go back and reoperate on the patient. Staffing. An overworked nurse mistakenly administered insulin instead of an anti-nausea medication, resulting in hypoglycemic coma. Whenever staffing is overwhelming, as it is potentially right now with this COVID-19 coronavirus situation, when people are overworked, working more hours rather than less, they may actually make more mistakes, and we have to keep that in mind. Task-related. An intern incorrectly calculated the equivalent dose of long-acting MS-Contin for a patient who had been originally taking Vicodin. The patient experienced an opioid overdose and aspiration pneumonia, resulting in a prolonged ICU course. In this case, obviously, the calculation was a task that needed to be done. And because that task was done incorrectly, this is a task-related factor that leads to a latent error. We also have patient characteristics. The parents of a young boy misread the instructions on a bottle of acetaminophen, causing their child to experience liver damage. So this type of error is not only just regards to the patient, because the patient is young and potentially may, not necessarily tolerate an adult dose or even a super therapeutic dose of acetaminophen. But it also has to go in regards to the patient characteristics. The patient's a young boy. The parents are the ones who are administering the medication to him. So it also might be related to the parents. But regardless, it's still a patient characteristic related factor. As an example, in healthcare for RCA, a paper described a patient who underwent a cardiac procedure intended for another similarly named patient. A traditional analysis might have focused on assigning individual blame, perhaps to the nurse who sent the patient up for the procedure despite the lack of a consent form. Obviously, there are certain things that could have been done to remedy this, though. We do have barcode medication administration. We do have patients who can repeat their name a lot of times back and state their date of birth as an additional identifier. A lot of times we do like to use multiple identifiers to identify patients, and anytime that we can use barcode medication administration, we always like to do that, especially for medications, but not only just for medications, but for procedural things such as going down to a procedure. Anytime the patient has to move, they should probably be barcode scanned. Root cause analysis is a widely used term, but it's very misleading. There are multiple errors and system flaws that have to intersect in order for a critical incident to reach a patient. So we have lots of different factors or the causes that place undue emphasis on those holes in the system and obscure overall relationships between the different layers in the system design. Some have suggested replacing the term root cause analysis with systems analysis, because root cause may just implicate that there's only one root cause, and it may be a systems related issue. There might be multiple causes. So always keep that in mind, that there may be more than one root cause in regards to your actual problem. RCA is probably one of the most widely used approaches to improving patient safety, but perhaps surprisingly few data exist to support its effectiveness. And whenever you do your homework for this section, you'll actually read a little bit about some of the data that is out there for RCA. As known, much of the problem in RCAs relies on how they're interpreted rather than how they should be performed, and there's no consensus on how you should follow up or analyze RCA data. And this obviously limits RCA as a quality improvement tool. Another issue is that few formal mechanisms exist for analysis of multiple RCAs across institutions. An individual RCA is essentially a case study of a specific error. Analysis of multiple RCAs at different institutions may help identify those patterns and point towards solutions for an individual problem. Almost kind of what you would know as a case series. So multiple individual cases together may actually point you in a better direction of how you should go about doing a process. Some states mandate an RCA for certain types of errors and report the findings of these RCAs in aggregate. The Joint Commission has mandated the use of RCA to analyze sentinel events such as wrong site surgery since 1997. As of 2009, about 25 states and Washington, D.C. have mandated reporting of serious adverse events increasingly using the National Quality Forum's list of never events, and many states also require that RCA be performed and reported after any serious event. Although no data is yet available, RCA use has likely increased with the growth in mandatory reporting systems. So again, this is a multidisciplinary approach. We find out what happened, why it happened, and how we can prevent it from happening again. And we want to establish that culture of safety based on prevention, not punishment. We should ask, how the system functions. We focus on the how and the why, and not on the who. We focus on problems in the actual system. We don't focus on necessarily who did it. Now, every individual system and every hospital institution and other institutions out there have their own ways of dealing with discipline. Obviously, we want to encourage the process approach first, and what is the problem in the system. Now, obviously, if one nurse is having multiple problems with many different events occurring, then that's probably a situation where you might potentially entertain asking about the who. However, you want to look at the process. You don't want to focus on the person who was involved in the error. Or persons who were involved in the error, because sometimes it may be multiple people. It could be nurses, physicians, and pharmacists, especially if a medication gets to a patient. Because people on the front line are usually the best to identify these issues. RCA teams formulate solutions. They test, implement, and measure outcomes in order to improve patient safety. A lot of times these are physicians, nurses, and pharmacists. But they can also include other healthcare professionals, depending on that healthcare professional's area of expertise. So again, goal of RCA, what happened, why did it happen, and how can it be prevented from happening again? Not who. Again, not who. The RCA process is a tool for identifying prevention strategies. It's a process that's part of our effort to build a culture of safety and move beyond a culture of blame. Always address the system and not the individual. In an RCA, we have basic and contributing causes that are discovered in the process, similar to diagnosis of a disease, but we always want to keep in mind preventing recurrence. So this process is interdisciplinary. It involves experts from the frontline services. It can involve everyone. Even pharmacy technicians might be involved in the RCA process. Pharmacy interns, pharmacists, physicians, nurses, respiratory therapists, dietitians, involving those who are the most familiar with the situation. Continually digging deeper by asking why at every level of cause and effect. And the more you ask why, the better off your actual root cause map will be. Whenever you do your projects, the more you ask why, the better you are able to actually identify the actual root cause. A process that identifies changes that need to be made to systems. A process that is impartial as possible. To be thorough, you should determine human and other factors in an RCA, determine related processes and systems, analysis of underlying cause and effect systems through why, or asking why, identifications of risk and their potential contributions, determination of potential improvement in processes or systems. To be credible, an RCA should include participation by leadership of the organization and those most closely involved in the processes. So it should really be everyone. And it should be internally consistent. If you go about doing an RCA in a certain way at one hospital, you should stay consistent for all RCAs at that hospital. And you should also include consideration of relevant literature, particularly if your RCA question or your RCA situation has specific factors to consider. That is it for this talk for today. Please let me know if you have any questions. Thank you and have a great day.